probably the best choice I've ever made.
I would do it all over again.
Uterine fibroids is a serious condition that affects many women in the United States today. The most common symptoms caused by fibroids are bleeding, pressure, and pain. Bleeding can present in many different ways, whether it's heavy bleeding with blood clots passing during the menstrual cycle, or abnormal bleeding in between menstrual cycles, or just an increased frequency of menstrual cycles where women are having cycles more than once a month. Bleeding, when severe enough, can lead to anemia. Anemia is often experienced by having weakness, generalized fatigue, or exhaustion when trying to do regular everyday activities. Another common complaint women have with uterine fibroids is pressure symptoms related to the bulk of the uterine fibroids. Urinary frequency, going to the bathroom many times during the day, or even waking up at night to urinate, is common. Others may complain of pain, typically in the pelvis, lower back, or upper thighs when it's related to uterine fibroids. Until recently, women only had surgical options to treat their uterine fibroids: a hysterectomy, where the entire uterus is removed, or a myomectomy, where a gynecologist surgically removes individual fibroids one fibroid at a time. Now, with uterine fibroid embolization, also known as UFE, there's a less invasive, non-surgical option available to treat uterine fibroids. This less invasive option, UFE, allows women to keep their uterus, but live a symptom-free, healthy lifestyle after a successful treatment.
UFE is typically performed by interventional radiologists. Interventional radiologists are physicians who specialize in minimally invasive, targeted treatments. They use imaging to guide small catheters through the body using tiny holes as opposed to open surgical wounds. This is done with X-rays, ultrasound, CT, and MRI. Women who are suffering from uterine fibroids should visit the Northside Interventional Radiology Clinic. The first step in the patient's road to recovery is the consultation. This lasts about 45 minutes. Patients will discuss their treatment with the interventional radiologist and the interventional radiology nurse coordinator. MRI results will be reviewed. During the consultation, the patient will have her questions answered and all treatment options will be discussed. The patient will be told if she's a candidate for uterine fibroid embolization. Most patients are candidates for UFE, but some women may have misconceptions about the procedure. Some believe their fibroids are too large or they have too many fibroids. Most times these statements are false. For over a decade, the well-respected interventional radiologists at Northside Hospital have worked with hundreds of gynecologists and family practitioners from Northside Hospital and many other institutions.
We have 3 dedicated nurse coordinators for the UFE patients, and we help you through every step of the process, from the initial consult through the follow-up visits. We also help you navigate the insurance coverage. Nearly all insurance companies cover UFE. So if you're a candidate for UFE and you feel this is the best treatment option for you, a date is chosen for the procedure.
On that day, you will be taken to a private room. Here the nursing staff will complete all the necessary paperwork, address your needs, and give you light sedation. Then it's time for your UFE. UFE, unlike surgery, is performed with only IV sedation and local anesthesia, which is safer than general anesthesia, which is required with surgery. At Northside Hospital, the procedure begins in our state-of-the-art interventional radiology suite. Only one small incision is made. It's approximately 1/8 of an inch, the size of the tip of a pen, and a small catheter is inserted. This catheter is guided into one uterine artery. Tiny particles are then put into the artery. They block the blood flow to the fibroids. The fibroids shrink and become small scars. The particles used in this procedure are safe and have been used for over 10 years and are specifically approved for UFE. The catheter is then guided to the other uterine artery where the procedure is repeated. The entire procedure takes 45 minutes. The patient then goes to a private recovery room. Here they stay for 23 hours or less, with some even leaving the same day as the procedure. When the patient is ready to leave, she's able to maintain her uterus and go home with a small Band-Aid or nothing at all.
Well, for me, the procedure wasn't difficult at all. I came in on the day of the procedure, was back in my room within an hour. Dr. Levy and his nurse stopped by. The next day I went home, no complications at all.
This option was the best option for me. It was, I didn't want to do a hysterectomy. This was something that, was a much more minimal invasive procedure, better, less recover, a shorter time to recover, and it was the best option.
The reason why I chose the UFE is because the UFE, once I had the process done, the beads that were going to be inserted was going to take care of small, big, whatever size fibroids that I had. It was going to be taken care of in one knot. Why not have it? One time, that's it. And that's why I chose the UFE.
UFE patients recover in just a few days compared to several weeks for surgical procedures. 2 weeks after the procedure, patients return to the interventional radiology clinic for a checkup. They're also given 24/7 direct contact numbers for any post-procedure questions or concerns. There are a number of advantages to UFE over surgical procedures. No need for general anesthesia. Only one incision, which is much smaller than any surgical incision. Laparoscopic and robotic surgeries require up to 5 incisions. It is the only procedure that can treat women with numerous fibroids and still maintain the uterus. Less invasive and fewer complications. Shorter hospital stay. Shorter recovery, about 5 to 8 days as compared to several weeks. Why pick Northside for this procedure?
The care I got at the hospital, and then the follow-up. They were there. Dr. Levy was there, but Mackenzie was really you could really get information from her, so you didn't have to wait to hear back from a doctor. You had a nurse that was right there for you.
The physicians at Northside Radiology Associates are the only practicing interventional radiologists at Northside Hospital, Atlanta's women's hospital. They have extensive experience with some of the more challenging uterine and gynecological problems that are sent to Northside from other institutions. This team of experts is dedicated to women's health, and they have one of the busiest UFE practices in the Southeast. For more information, call 404-851-6063 or check out our website at www.ufeinatlanta.com.